Charles Locke in Orlando at the AHA annual meeting, and I'm here for On the Scene. With me is Mark Eisenberg from Montreal, Canada, and Mark has just finished reporting on a smoking cessation study called Evita using Varenicline. We know it as Chantix here in the United States and Champix, I guess, in Canada. An extraordinarily interesting study. I'm going to let Mark tell us exactly what this study was. So Mark, what was the study? And then we'll talk a little bit about outcomes.
Well, the study was very simple. We know that patients with acute coronary syndromes, with heart attacks, unstable angina, that are smokers, have a very difficult time quitting. Less than a third of them quit. So we wanted to randomize patients to Varenicline versus placebo and see if we could impact on smoking cessation rates. We showed a substantial reduction in smoking at 6 months with Varenicline. Close to 50% of patients had quit with Varenicline versus less than a third with placebo.
Okay, so, I mean, we know that Chantix works. We've known that for a long time, not perhaps this well. This is much better than my experience anyway in trying to get my patients to quit after an acute coronary syndrome. What do you think made the difference? Did you do a lot of counseling with these folks? But this was also placebo-controlled.
Right. So patients in both arms of the trial got low-intensity counseling. We didn't want to give high-intensity counseling, hard to deliver to large volumes of patients at many hospitals. But these patients are different than the patients in other trials. They're older. They've been smoking over 30 years. They smoked, I think, on average 36 years. They're smoking a pack a day. But they have a different kind of motivation. They just had an acute coronary syndrome. 84% had angioplasty. Less than 10% had bypass surgery. Their families are on their backs to quit smoking. That plus the medication, I think, made the difference.
So, as a clinical note here, I mean, what did we learn, Mark, from this trial that's brandy new? The rate of smoking cessation, or the fact that you need low-grade counseling, or a combination of the two? If you were to say, what does this trial really teach me? Give me the short version.
I think this is a proof of concept trial. We have a drug that we know works in other populations. We do not start non-smoking medication typically in hospital right after an ACS. Their first dose was in hospital, and we give lots of other medications in hospital. We give aspirin, we give Plavix, we give statins, we give beta blockers, we give ACE inhibitors. Should there be another medication for smoking cessation started in hospital? I think so.
Okay, so there you have it. Chantix works. 50% is still a pretty good outcome if you can keep 50% of your people from not smoking. So maybe a lot more to learn from all this going forward. Thank you, Mark.
Thank you.